Thank you. So, hello and good morning, everyone. I'm delighted to follow on from some of the wonderful talks this morning around things to do with co-creation, participation, and how we're involving members of the community in the work that we're doing. In my talk today, I'm going to be discussing how stigma shapes youth mental health journeys in often complex and invisible ways. At a conference on innovation and the next generation, I think it's particularly important that we centre the voices of the next generation in the work that we are doing. I'm going to be drawing on some of my own participatory research findings, as well as broader contemporary research, to highlight the ways in which we are currently missing youth voice in how we conceptualize mental health stigma, and the ways we can change our practice and think about the things that they need in the way that we move forward. So a brief introduction to me. I won't go into too much detail because you've all seen the programme, but for those that don't know me, I've seen many familiar faces today. I'm Dr. Rebecca Johnson, a lecturer in psychology at GCU with a specific focus on mental health stigma experiences of children and young people. My area of expertise is participatory research methods, so including young people meaningfully in the co-creation of knowledge in a way that shares the power of knowledge creation with the people that it will impact, including creative methodologies. Susie earlier spoke about epistemic injustice. So this idea of who do we think creates knowledge? Who do we think has the right to create knowledge? And I think that should be with young people. So I've worked directly with young people for many years now as a youth worker and as a researcher. And I've seen firsthand how very often they are spoken about, they are spoken for, but they are less often spoken to and with. So that's the thread I'm pulling on today. What happens when we truly centre youth voices to reshape the way we understand how they experience stigma and barriers to mental health care? So a brief disclaimer on the things I talk about today. I'm specifically talking about challenging the power that adults hold. This is not to invalidate any work being done with children and young people by adults. It's specifically to consider innovation. So if we want to innovate, we need to hear unheard stories. And many young people feel unheard at the moment. So keep this in mind as I go through. So we talk about stigma a lot, but to innovate, we need clarity. There's often a lot of vague terms in mental health stigma. So mental health stigma is the social process by which individuals with poor mental health or mental illness, including symptomology, we're seeing now that it doesn't have to come from a label. It can come from displaying symptomology and being identified as someone with poor mental health. We see these individuals labelled, stereotyped and discriminated against, which leads to status loss and exclusion. I'm hard pushed to believe that anyone in this room is unfamiliar with mental health stigma. There are lots of different types of stigma. We have public stigma, the shared societal beliefs and attitudes about stigmatized traits and identities. Internalized or self-stigma, when these attitudes are taken on and believed by the individuals. Structural stigma, when organizations and structures have policies, procedures, and cultures that disenfranchise individuals with poor mental health, and many more. And importantly, something that doesn't change no matter how much research we do is to see that stigma is a key barrier to help seeking across all populations. We're now seeing stigma defined as a wicked problem, one that is nefarious, has a complex web of impacts, and requires innovative solutions. And also in reference to the research area, we're seeing a huge increase in stigma research, which is leading to conceptual fragmentation. So too many different definitions, too many conceptualizations, and essentially studies that we can't compare to get a broad understanding of mental health stigma. And unfortunately, the picture doesn't get too much clearer when we look at children and young people's literature specifically. So let us start then with a clear fact. The mental health stigma field is adult-centric. That is a fact that's found consistently. And what this means is that research in the area, when working with children and young people, is still predominantly drawing from adult-derived measures, models, definitions, and conceptualizations. But adolescence, as I'm sure we are aware, is a different landscape. Developmentally, socially, emotionally, we've not been using the right map to capture this. While similarities exist in how adults and children and young people experience stigma, we have emerging research that is showing us that there are unique components in youth stigma experiences that are not being considered. So when applying adult models and definitions, we are missing unique youth experiences. Youth contexts are also incredibly unique, not only in the fact that they are in different physical environments, schools, more often living at home, they're also in unique developmental landscapes, at greater risk of damage to their identity formation and with a greater impact of peer isolation. And most importantly, we see young people, children and young people, hold less power in society to challenge stigma the way adults do. They do not yet have the skills, they do not yet have the authority to challenge stigma when it is faced. So it poses a greater risk in many different ways. And a lot of this comes down to adultism. Adultism refers to the ways in which children and young people are subjugated by adults and adult-fitted systems. It is the pervasive societal belief that adult voices and experiences are more worthy of action, that they're more intelligent, rational, logical, purely because they are adults. And it sees children and young people and their experiences interpreted through adult lenses. So we are adults that get to decide whether their experiences make sense to us as adults and fit in our adult systems. And that does not always work for young people. In mental health settings, what this sees is adults who fundamentally believe they know what is better for a young person than they do. And while there are always things we need to draw on from our adult perspectives, we all know a lot of things. It's not that we don't know anything. But we discredit young people for knowing about their own lives, using this adult lens and this adult view. So what is missing when we use this adult lens? When we turn to focusing on young people specifically, we see time and time again that they report stigma as their largest barrier to help seeking. So what components are missing from our current conceptualization and understanding? That's the context for my doctoral research, to create something new, rooted in what young people actually experience. So Susie introduced the peer researcher role earlier. My PhD included 3 young people with lived experience of poor mental health, mental illness, and mental health stigma as co-researchers alongside me. They were involved in every phase of my research, designing ethics, conducting peer-supported interviews, data analysis, dissemination. It's very strange for them not to be with me today, but none of them were available. And designing every outcome. Everything we've written together. Okay, it's to center, when we say we want to center youth voice and we want to remove an adult lens, an adult cannot do that alone. Our outcomes were a measurement tool and a conceptual framework. But as much as I would love a captivated audience to talk purely about my doctoral research for the next 10 minutes, I'm not going to do that. I would like to hone in on the unique components of mental health stigma we identified in youth from the qualitative component of our research, so that I can equip you to understand how young people actually feel. So in our research that set out to investigate how young people experience stigma, there was one concept that stood out as wholly unique to young people. And that is their experience of adults misusing power they hold over young people to stigmatize them and entrench those stigmatizing beliefs. While a lot of research studies focus on peer-to-peer interventions, peer-to-peer stigmatization, the most important finding from mine and other contemporary studies is showing that adults play a unique role in the stigmatization of youth and their mental health. And we can no longer focus only on peer-to-peer stigmatization. We must turn to the role that adults play. Young people told us over and over that the stigmatization experience from adults was most painful because adults stand in the way of their access to services. Adults gatekeep support for young people. Adults are the ones to decide if they're being referred, if they're accessing support, if they are perceived as legitimate, and then furthered and put into different contexts. So whether that is parents responding in a particular way, being dismissed by services, teachers minimizing experiences, it cuts deeper for young people because it directly links to the power adults have over support, access, and legitimacy of youth mental health. So what did this actually look like in my study and others? It looked like adults across their lives fundamentally not believing their experiences, most often through the act of minimization. This was also reflected in action or inaction. When young people were faced repeatedly with delays, lack of transparency, actions not being followed up or followed through, no communication given when decisions were made without young people, reinforcing the idea that adults get to dictate how young people's experiences should be acted upon and perceived. Infantilization was also a huge component. We had a range of ages in our participation, but children and young people at the ages of 15, 16, 17, we're really talking about the fact that when I'm treated by adults, I'm often treated like I am still under the age of 10 because I have poor mental health. We see research showing us that psychiatrized youth are often, their distress is viewed as incapacity, is viewed as a sign of infantile behavior. And this sheds a light on the paternalistic nature of our interactions, or some of our interactions with children and young people. And some participants in our research even reported their distress being met with punitive or controlling actions, having opportunities removed from them, being taken off of school trips, having phones removed, access to resources removed, and having privileges taken from them because they disclosed that they were struggling, and that was perceived a certain way by the adults in their life. Importantly, this goes beyond our understanding of clinician-client power imbalance or anyone working with young people. I'm sure you've reflected on this, that in these settings, you have power in your role as a practitioner, as a clinician. But this component of youth stigmatization goes beyond that and refers to the unavoidable and always present nature of the inherent power imbalance between an adult and a child or young person. In every stage of a young person's development, they are always faced with adults who can make decisions for and about them without being involved. Unlike in many settings for adults, young people can't just leave school or go to HR or file a complaint. They can't leave their homes. Some of them are forced into this. It's not their option or not their choice, but often they are at the mercy of the adults in their lives. The inherent power imbalances that some adults misuse mean that stigma often must be endured in unique ways by young people, because challenging your elders or people in positions of power is frowned upon and taught that is inappropriate. And this shows us that stigma is more than just a social attitude, or even more than just prejudice from a group with slightly higher power. For young people, it is about the interplay between stigmatizing attitudes about youth mental health and the fact that they can be enacted by adults who hold power over them and misuse that power to entrench stigmatizing attitudes. Because adults can validate or silence, they can include or exclude, and the consequences are not abstract. They shape whether a young person can seek help or not. This power imbalance was most felt and most detrimental to young people in structural contexts that placed young people at the bottom of a hierarchy, places like school, healthcare, and home. And our research is one of the first to identify some key components that make up stigmatizing structures for young people. Firstly, there is a lack of resource or prioritization of youth-specific mental health needs. So in this setting, there may be general mental health knowledge and understanding and awareness of mental health, but that may be adult focused, and it might not have enough understanding of youth-specific experiences of mental health and the way they are felt, dealt with, and addressed. Secondly, they strongly reference the idea of a negative culture, one in which belittling or undermining youth mental health is accepted. So we may see this, we see adultism coming back in here, this idea that we can belittle young people in terms of attention seeking or it not being something they will yet understand because of their age. But it was often in these cultures, adults were banding together to create this negative culture of dismissing young people. And lastly, we see the reference of tokenistic action. So contexts where on the surface action has been taken, but this is clearly to fulfill a tick box. And young people surprisingly told us that they would rather adults do nothing than do something that is tokenistic, which may be surprising for many of us because we may think something's always better than nothing, right? Young people disagreed. They said it wasn't enough. And they said that they can tell and they feel when actions are taken without their consideration, without true understanding of what they need, and without genuine care and seeking resolution. So throughout my engagement with my co-researchers, other young people, including research findings, I want to begin wrapping up with some practical implications for working with young people. Because young people often, when they spoke about adults misusing power, they also spoke about the inverse. And they said that good adults stand out to them because they go against the things that they've always experienced. So firstly is to remember that when you give dismissive responses, young people believe you. Young people internalize adult responses. Your power positions you as an expert, and young people believe that. One of the most impactful discussions I had during this research was when a young person told me when they said I was a problem, I believed them, because why would the adults be wrong? And it took her working with further adults and further support options to realize I was never the problem. It was the fact that no one saw me, no one understood my specific youth needs, and no one allowed me to receive the support I needed. Evidence tells us that young people are beginning to expect stigmatization, especially minimization, and specifically from adults. Prioritize listening without judgment and without minimization. While I know many practitioners working with young people are advocates of youth voice and do apply these principles, it may not be your own minimization you are talking about. Parents, carers, colleagues, other people around you will dismiss young people, and young people need to see you in your practice challenging these dismissive attitudes, showing that you are willing to create spaces for them to be heard, challenge that power imbalance they experience, and equally value their voice and their contribution. Recognize how structural policies reinforce stigma. Inflexible procedures, meetings cut short, deferring to parents predominantly over young people themselves, all reduce young people's sense of agency and safety. Relying too heavily on information from caregivers is something that young people often report finding extremely distressing because their experiences are being warped through an adult lens that they cannot combat. They do not have the power to override adult opinions of them. They find it incredibly distressing. Advocate for trauma-informed, youth-sensitive approaches, and where you have to work in stigmatizing structures, small changes in your own practice can make the largest difference. An example from my own research, a research-specific context. In my research, I was never going to be able to not seek parental consent. That was always important. But myself and my team, my co-researchers, were really passionate about never going above a young person, always working through a young person. So we designed a new consent procedure where we sought initial consent from young people and then collaboratively sought parental consent with a young person. So the young person was always driving the work that we did. And they found it really meaningful that we never ever spoke about them without them, because that's the expression, isn't it? Nothing about us without us. Be aware of the power you hold and use it transparently. We all must remember the layers of power imbalance that a young person may have had to navigate before they get to us. Recognize that you are an adult that holds power over a young person. As much as you may feel that you are working with them collaboratively, you always, at the end of the day, hold that power. And research is showing us, that the young person in front of you has been dismissed, has been discriminated against, has had that power misused by adults in their life. So just by being aware of this, by being cognizant, using that in your practice, giving it a name, speaking about it, making effort to redress it with young people collaboratively is already starting to challenge that. Include young people in shaping their care. Participation doesn't end at research. It shouldn't. Co-design support plans, language use, service evaluations, wherever possible. It's often easier to make decisions without young people, but that's not the point. Okay? I also think that across institutions, discussions of power need to find their way into our practice. Discussions with other practitioners in supervision, in professional settings, and welcoming these when they arrive so that we can recognize that it's not about blame, it's about growth. And where you can, avoid defaulting to adult-derived frameworks, how you conceptualize the work you're doing, measurement tools, definitions, models, theories. Where you can, draw from youth-focused. So this is not about blame or pointing fingers. Many of us are so busy we don't have the luxury to find time for a tea or a lunch, yet alone a deep reflection on emerging literature. But it is enough to ask questions and to consider your role, because truly there is no right answer. The perfect approach is designed with each individual young person, with the experiences they bring to you and your recognition of your own power. So to conclude, and hopefully to keep me to time, currently there are no interventions that address adult stigmatization of youth. They all predominantly focus on peer-to-peer interventions, even though research is telling us that this is not just something that exacerbates stigma. For young people, adults play a unique role in stigma. So we need interventions to tackle it. So while there are no campaigns, educational interventions, no training-related interventions, adults, we have work to do on ourselves. I am working on the intervention part to the best of my ability. It's not enough for us to simply not stigmatize young people overtly. That's the basic. We need to be recognizing the power we hold and pushing for change. We need to be reflecting on the ways we can rebalance that power. We need to reduce adultism through our own reflective work. But most importantly, we need to listen to young people and be ready to hear what they say. It's not comfortable being told that we may be part of a problem, but we're the ones with power and we're the ones that can change it. So we need to go beyond just listening and create spaces where young people can share, be involved in decision making, and see action on the things that they tell us. So at a conference I attended on Wednesday, I delivered a similar talk, and I was lucky enough to have 2 young people immediately follow me and give me reflections on the things that I'd talked about. And they specifically reflected on what good adults can do. So I want to end on a reflection from young people. So the young person said, every decision you make with a young person and not for them gives them back a piece of their autonomy that they may have lost and adds another good adult into their world and their periphery. So after today, I hope that you are ready to hear what young people are telling us, ready to reflect on your own power and to add more good adults into the periphery of young people. Thank you for listening.